Today we can discuss about circulation of blood through the heart, blood supply and the nerve supply of the heart. Superior vena cava and inferior vena cava are the major blood vessels which carry deoxygenated blood from various parts of the body to the right atrium. From the right atrium, the deoxygenated blood will be carried to the right ventricle through the tricuspid valve. From the right ventricle through the pulmonary valve, the deoxygenated blood will be carried by the pulmonary artery to the lungs for purification. And from the lungs, the oxygenated blood which was purified by the lungs was carried by the pulmonary veins to the left atrium, then to the left ventricle through the bicuspid valve. And from the left ventricle, the aorta carries the oxygenated blood to various parts of the body. So here we can able to see two types of circulation, systemic circulation as well as pulmonic circulation. So in detail you can see the blood flow through the heart. The blood flow starts from the right atrium, then it flows to the right ventricle through atrioventricular and the tricuspid valve. From right ventricle it flows through pulmonary valves into the pulmonary artery and then to pulmonary trunk. The pulmonary trunk branches to form right and left pulmonary artery for gas exchange at left and right lungs. From lungs, the oxygenated blood comes to the left atrium through pulmonary veins. From left atrium, blood flows through mitral valve or left atrioventricular or bicuspid valve to left ventricle. Hope you understood. From the left ventricle, blood is pumped to aorta through aortic valve, and then the venous drainage from different parts of the body brings deoxygenated blood back to the right atrium through inferior vena cava and superior vena cava. So here we can able to see the whole circulation of blood, again the pulmonic circulation as well as systemic circulation. Next we can see the coronary circulation. So for coronary circulation, what do you mean by coronary circulation? Coronary circulation means heart is the major circulatory system which needs blood supply also. So for that, coronary arteries supply blood to the heart. So the supply which heart received is through the coronary arteries. Next we can see the arterial supply of the heart. Myocardial cells receive blood supply from coronary arteries both right and left. The closure of the aortic valve during ventricular relaxation prevents the backflow of the blood and fills the coronary artery. So here the closure of the aortic valve during ventricular relaxation prevents the backflow of the blood and fills the coronary artery. The arterial supply of the heart is provided by the right and left coronary arteries which arise from the ascending aorta immediately above the aortic valve. The arterial supply of the heart is received by the right and left coronary arteries of the heart which arise from the ascending aorta immediately above the aortic valve. Next we can see the branches of the coronary arteries. The coronary artery used to have right coronary artery and left coronary artery. Right coronary artery has right marginal arteries and posterior descending artery. Then the left coronary artery has circumflex artery, left marginal artery, left anterior descending artery as well as diagonal branches. Here we can able to see the major blood vessels and the coronary arteries. It was differentiated in the blue color as well as the red color. You can just see the image clearly and just try to learn the thing. Next we can see the venous drainage of the heart. So venous drainage, here most venous blood from the coronary capillaries drain into the coronary sinus. So here if you are visualizing the image, we can able to see the coronary sinus clearly, which this coronary sinus lies in the posterior part of the Atrioventricular groove. Some veins do not enter the sinus, rather it drains the venous blood directly into the right atrium with inferior vena cava. Next we can see the nerve supply of the heart. So related to the nerve supply of the heart is supplied by nerves arising from superficial and deep cardiac plexus. Nerves arising from these plexus run along the coronary arteries and supply the heart. These contain sympathetic as well as parasympathetic nerves. Sympathetic nerves are derived from upper fourth or fifth thoracic segments of the spinal cord. They are cardio-acceleratory and on stimulation increase heart rate as well as dilate the coronary arteries. These sympathetic nerves helps to stimulate the heart rate as well as it helps to dilate the coronary arteries. Next we can see the parasympathetic nerves. Parasympathetic nerves are derived from vagus, which arise from the dorsal nucleus of vagus, which helps to slow down the heart rate and helps to constrict the coronary arteries. So today we have discussed about the coronary circulation of the heart, blood supply to the heart as well as the nerve supply to the heart. Hope you have understood. Thank you so much.